Hello, everybody. I am Dr. Farhadi. I am a neonatologist and I am an academic member in Mazandaran University in northern Iran. First of all, I would like to thank the organizers of the CDH conference, especially dear President Don Allen, for giving me the opportunity to attend this conference and introduce one of our CDH patients. Here, I introduced a rare case of a diaphragmatic hernia in a premature infant who was referred to our center in northern Iran about 5 years ago. The title of my presentation is Association of Imperforate Anus and Congenital Diaphragmatic Hernia in one of the twins who conceived by assisted reproductive technology. The incidence of congenital diaphragmatic hernia, CDH, is approximately 1 in 3,000 live births, and imperforate anus occur in 1 in 2,500 to 5,000 live births. Although associated anomalies are common in each of these conditions, combination of CDH and anorectal malformation is rare. Compared to naturally conceived pregnancies, birth defects occur more frequently in singleton newborns conceived by assisted reproductive technology. On the other hand, the risk of birth defects is higher in twins. Indeed, aortic conceived twins have a much higher risk for birth anomalies. In this report, the combination of imperforate anus and CDH has been described in one of twins who conceived by ART. A 32-year-old primi-gravid woman delivered a male and a female of twins at 27 weeks gestation by emergency cesarean section due to severe preeclampsia and fetal distress. The pregnancy was induced by in vitro fertilization technique, IVF. Prenatal ultrasonographic scan at 24 weeks had shown diaphragmatic hernia in one of the twins. There were no family history of CDH or other congenital defects. Mother had no history of smoking, alcohol, or other illicit drugs intake during pregnancy. After delivery, twins were referred to our neonatal intensive care unit. In twin 1 and twin 2, birth weights were 1,200 and 1,100 grams respectively. Twin 1 only had mild respiratory distress syndrome without any gross anomaly that managed with continuous positive airway pressure, CPAP. Twin 2 presented with severe respiratory distress syndrome and hypoxic respiratory failure and was immediately intubated and required to ventilator therapy. On physical examination, breath sounds in the left side were diminished and heart sounds were strongly auscultated on the right side of chest. In addition, she presented with imperforate anus without perineal fistula. This picture shows the baby's imperforate anus. She had no deformity of limbs or facial dysmorphism. Echocardiography revealed a small atrial septal defect, ASD. Arterial blood gas revealed severe respiratory acidosis. Chest X-ray showed herniated bowel loops into the left thoracic cavity, which contributed to severe lung hypoplasia and shift of heart to the right side of the mediastinum. This picture shows the plain radiography of the patient. As you see, herniated bowel loops into the left thoracic cavity and shift of the heart to the right side of the mediastinum is seen. No vertebral or lumbosacral abnormalities were seen in a spinal X-ray. An ultrasound scan of the kidneys was reported normal. Surfactant was still intratracheally and she received respiratory support with high-frequency oscillatory ventilation because of no response to the high setup of conventional mechanical ventilation. Respiratory failure was not treated in spite of using above treatments, so surgical repair was not possible because of poor clinical condition. Unfortunately, she expired 18 hours after birth as a result of severe lung hemorrhage and cardiorespiratory collapse. This report has been described a pair of aortic conceived twins in the one of whom an imperforate anus and a left CDH coexisted. Association of CDH and anorectal malformation is rare. Approximately 40 to 70% of neonates with anorectal malformation have additional congenital anomalies, and the most commonly affected organ system is genitourinary tract. Other important associations include Vactal anomalies and trisomy of chromosome 21. Vactal anomalies, as you know, include vertebra, anorectal, cardiac, tracheoesophageal, renal, and limb anomalies. CDH has been rarely reported as an associated anomaly in anorectal malformation. The frequency of additional congenital malformations in the patients with CDH ranges from 30 to 40%. Walters et al. Reported a newborn with imperforate anus, horseshoe kidney, pulmonary sling complex, and diaphragmatic hernia. In their report, CDH had a latent delayed presentation at 4 months of age when the infant was admitted for a definitive laparoscopic assisted pull-through operation. Round et al. Described a neonate with a combination of CDH on the right hemithorax and anorectal malformation. The patient was a term neonate without respiratory distress or other associated anomalies. Similarly, Chen et al. Described a neonate with Vactal association and right-sided CDH. Cho et al. Carried out a long-term retrospective analysis of 103 patients with anorectal malformation and described associated malformations of these infants. Only 3 patients had CDH in combination with an anorectal malformation that emphasized to the rarity of this coexistence. Mirza et al. Reported a case of imperforate anus associated with eventuation of the diaphragm in a newborn infant who underwent a sigmoid colostomy and plication of diaphragm on 2nd and 8th days of life, respectively. A noticeable point in our report is the presentation of this associated rare anomaly in one of the twins who conceived via IVF technique. Already, a few cases of CDH or anorectal malformation have been reported in both twins. Kobiak et al. Reported a case of isolated imperforate anus in monozygotic twins. Ono et al. Described the case of CDH in dizygotic twins. According to Ono et al.'s report, patients were the 6th survived cases of twins with CDH in the literatures. CDH in all cases was in the left hemithorax. Indeed, these cases confirm that although CDH was a sporadic event in majority of cases, the rate of genetic factors in its etiology could not be completely excluded. Concordance rate of birth defects after aorty among twins suggests that familial aggregation is a factor in some birth anomalies. It is well known that birth defects are more frequent in twin babies than singleton infants. On the other side, aortic conceived pregnancies leads to more twin pregnancies and following more birth anomalies. Increased risk of blastogenesis birth defects has been previously shown arising after aorty. Blastogenesis is referred to the first 4 weeks of embryo development. This association has been reported for esophageal atresia, cleft palate and lip, septal heart defect, and hypospadiasis. One of the specific defects in this category is anal atresia. A few studies have also described an increased risk of anorectal malformation. Zwinkel, in a German case control study, showed the increased risk of anorectal malformation among infants who born after assisted reproductive technology, IVF and ICSI. This risk was also observed among both singleton and multiple birth. Therefore, occurring ASD and anorectal malformation in our presented case can be reasonable based on previous studies. However, published studies do not suggest any information on the increased risk of CDH in aortic conceived babies. Although CDH is not likely to be specifically associated with ART, this is the first report of aortic conceived twins in one of whom the combination of CDH and anorectal malformation was observed based on search in scholarly articles. Unfortunately, in contrast to all above reports, our presented case had no chance of surgical repair. It was due to severe prematurity, very low birth weight, and severe lung hypoplasia. In spite of the low incidence of birth defects in the aortically conceived babies, continuing surveillance of them is necessary and the report of their birth defects is helpful. Indeed, most of the neonates conceived after ART are normal. However, there is increasing evidence that aortic conceived babies are at higher risk of birth defects and epigenetic disorders. On the other hand, many factors can influence the neonatal outcomes, such as risk associated with the ART procedures themselves, higher incidence of maternal nulliparity, advanced maternal age, and underlying etiology of parental infertility, among others. Therefore, the exact mechanism of occurrence of birth defects and genetic disorders in aortic conceived patients is still unclear. And in conclusion, report of this case may be useful to all caregivers in counseling patients about the birth defects risk of twin pregnancies conceived following ART. Further researches are needed to elucidate the mechanism of this phenomenon. I would like to thank the parents of the newborn for their permission in releasing the report of this case. In this slide, I put the references of our paper. We have previously published this case report in the Caspian Journal of Pediatrics and have discussed the baby in detail, and I have added the citation in this slide. And at the end, I sincerely thank you for your kind attention to the content provided, and since I am not English speaking, I apologize for any problem in this regard, and at the end I would like to draw your attention to some sites of Iran. Thank you very much and have a nice time.